This test is our upper quarter Y balance test. So similarly to our lower quarter, we have the same setup, which, just to remind you, is one line straight out, and then from that line we want 135 degrees to both of the Y angles, and obviously there'd be a 90-degree angle left here. So for this test, we are going to be looking for upper limb stability, and this test has a lot of reliable data and information that we can use and extrapolate for specific populations, and one of the only upper limb stability tests that does so. Now with this test, you can use a specific map that has these drawn out for you. You can also create your own with something like rigid tape. However, if you need something that is movable or you can't have it down all the time, the option obviously that we have here is drawing it. So you would obviously just use your tape measure, and then you would need an angle image meter, something like this, or a goniometer, to make sure that you are getting those 135 degrees accurately on either side. Just to explain the test to the client first, we have obviously these three markers here that can slide along, and the purpose for that is because we don't want Steph to be reaching and landing in that reached right hand. We want to make sure that she still has full weight and control in her left-hand side, as the left side shoulder stability is what we're testing. Obviously, if you didn't have these markers, you would just reach out with that hand, but you make sure that all your weight stays in the other hand, and you're just tapping a marker that you would measure later. So when she pushes that along, what she's going to do is make sure that her fingertips are the thing that's pushing it, and she's not grabbing the device or flicking it and losing contact with the device. So Steph's going to place her left hand, which is the hand we're working, on the center of the Y, and the other hand will be shoulder width apart. Now we want to make sure that this joint here, which is her proximal metacarpophalangeal joint of her third phalanx, or her third finger, is right on the middle of that Y. And from that position, we'll get Steph to go into a plank. So this would be our setup position. So the three angles that we're going to be testing are medial. Now this may seem counterintuitive, but remember it's medial to the working side. So medial to her left side would be this way, and then we're going superolateral, which is up to that 45 degree from neutral, and then underneath, and they swoop their hand underneath, make sure they're not reaching around, underneath 45 degrees backwards, which would be inferior-lateral. Those are our three measures that we're going to use, and what you do is you calculate those in centimetres, you add the total in centimetres, and that gives you one score. You repeat that 3 times, get the average of those, and that would be your testing score. So we're going to get Steph to do the test now. She's in her plank position with her hands in the right spot. When you're ready, Steph, we're going to go medially first. So reaching, and it's important she does not put her hand down in between the different positions, so she has to reach all 3 in one go, otherwise the trial is invalid. So with our inferior lateral marker, you can actually lift the hips and push as far as you can and do whatever you need to, so long as you're not actually putting that right hand on the ground. So then we would measure the inside of these markers, so that would be 1, and then obviously of the other sides as well, to generate our